Hi, my name is Jason Riis. This talk is called Lessons from Behavioral Science. The angle on behavioral science that I'm coming from is through cognitive psychology, which is what my PhD is in. My research has been about nudging, that I'm no longer an academic. I am now a practitioner. I founded the firm Behavioralize, a behavioral science consultancy. So I now am working with behavioral science from that practitioner perspective, and you may see that in the high level take that I give here. I'll briefly summarize the questions and my answers so you can get a sense of where I'm going with this. Why does most behavior change fail? Overconfident misperceptions and complacent inactions are fundamental human challenges. And I'll describe these a little bit. Each of them, I say these two broad features of human nature are kind of inevitable, and we need systematic ways to deal with each, indeed environments that help us deal with each. Second, what needs to happen for behavior change to be sustained, we need environments that use what has been learned about nudging and choice architecture. And we do know quite a bit about what those environments ought to look like. But still lots of progress needs to be made. What key studies are needed to progress? Well, studies of choice architects themselves and information architects. How can they implement and iterate best practices? How can they preserve freedom for users while reducing overconfident misperception and complacent inaction? So that's the roadmap. That's the take I'll have. And let me start here by describing what I mean by overconfident misperceptions. This is building on the idea that we think we know more than we really do. As Daniel Kahneman puts it, we can be blind to the obvious, and we are also blind to our blindness. As Adam Grant says, once we hear the story and accept it as true, we rarely bother to question it. Visual illusions are a nice demonstration of this idea. These horizontal lines look slanted or curved, and that is a series of tricks from the visual system. Shading, spacing in the figure create that visual illusion. What good information architecture would do would be to help us frame reality accurately, give us reference points and guidelines so that we can really see reality. So that'll be a metaphor for what I talk about along the way on overconfident misperceptions. And these are fundamental. We are just prone to this tendency as humans to think we know more than we really do, and to be overly certain about our beliefs, to believe that we're seeing the world, what we're really seeing is reality. The second fundamental challenge, complacent inactions. There's a lot of stuff that we don't do that we know we should. Here's a representation of the idea, famous Escher image. I've added this little good idea over here, and these figures just walk right past that good idea because they are doing what they have done in the past. They have their hoods over their heads. They're following the next person. They're going through the motions. And this is how we live a lot of our lives, and it's natural enough. It makes us efficient, but it allows us to walk right past good ideas that we might even know are there. As Richard Thaler says, if you want people to do something, make it easy. As Katie Milkman says, in general, we want to do what we know is good for us, just not right now. So we may feel that change is appropriate and lots of good things that we could be doing, and we'll do them later. And those are the fundamentals of human nature from the nudging perspective. Let me show a bit more detail about what this looks like. I'll put some names on some of the biases that cognitive psychologists and others talk about, and I'll give some glimpses into the kinds of things that seem to help, starting with these overconfident misperceptions problems. Knowledge illusion is an example. We tend to assume that we understand familiar things better than we really do. This image is from a famous study done. People were asked, how does a bicycle work? And these are people who knew how to ride a bicycle. They've been riding bicycles since they were little kids. Some of them were even expert cyclists. But you ask them how a bicycle works, to draw the mechanism, they can't do it. In this particular image, the person drew no gears. The gears are not connected to a chain. The chain not connected to the pedals. No mechanism for propulsion. But the bicycle's familiar, so we think we know how it works. In domains where behavior change really matters, this can be a real problem because we eat, we think we understand food, and we think we understand eating. Everybody has intuitions about what works and what's effective and what matters, and very often we're wrong. Because we hear people talking about things like metabolism, we tend to think that we understand metabolism. But of course, very few people really understand the thousands of processes that are involved in metabolism. But the fact that it's familiar, the fact that celebrities like Dr. Oz talk about it, get people to believe that things like metabolism boosters are real products that they can actually buy, and that they have more control over their metabolism than they really do. So here's a case where knowledge illusion, I think, looms quite large in the food space. Vague verbiage is another human tendency in terms of how we look at the world and how we think. This is a great figure created a couple years ago. Study was done around perceptions of probabilities. So people were asked about a variety of different probabilistic words, ranging from almost certainly down to chances are slight. And they were asked to assign actual probabilities to those probabilities. When you hear that term or when you use it. And the good news is that the terms that are associated with higher probabilities do in fact have higher probabilities assigned to them. But look how big some of these ranges are. For the word probable, people can put anything ranging from 50% to 100%. Very large variance around some of these. So we use our language quite loosely, and that can lead us to develop facts and mental models of the world that are really quite vague. We might think we're right when we say probably something will happen, but we never differentiated whether we meant probably like 90% or probably 50%. We tend to overstate our abilities to critically think. Here's a study that I did with Deloitte a couple of years ago. We asked people, how often do you make critical thinking errors? And we define critical thinking as the objective analysis of facts to form a judgment. You ask any cognitive psychologist that, how often do you make critical thinking errors? Well, multiple times a day. Even the best of us would say we commit critical thinking errors. But you ask the public, and 89% of respondents understate the frequency of critical thinking errors, at least by my definition of not noting or conceding that they do it every day. So we think we're better thinkers than we are. We're overconfident, nearly universal tendency to be too certain in our beliefs. Here's an example of how that was demonstrated. This is a study that we did last year in the context of travel health vaccines. We asked people a series of general knowledge questions like this. What's the approximate percentage of people who get infected with malaria per year in Kenya? Now, I think the correct answer is 5%, but I don't actually know the correct answer. When I did the study, I knew the correct answer, but it's okay to not know the right answer. But the idea with confidence is that you should have some idea of how correct or incorrect you are, how likely you are to be right. And that's where people tend to really fail. So we asked a series of questions like this, general knowledge about travel medicine and travel medicine vaccines. And then we asked people, how many of those 10 questions do you think you got correct? And here's what we find. And this is a very common finding. Versions of this, the original paradigm goes back to the 1970s. The actual percentage that people got correct was around 50%. So 48% they got right out of 10. How many they thought they got right out of 10? They thought they got 65% right on average. So they know they're not perfect, but they are much more imperfect than they realize. And this is a fundamental human tendency, and this is one big aspect of what psychologists talk about when they say that people are overconfident or overly certain. And it's a problem because, from a point of intervening or developing lasting behavior change, we might think, well, we focus on what they got wrong, got about half of them right. We can raise this blue bar by educating people. But what about that yellow bar? What about educating them on how much they don't know, or helping them become calibrated? That's a much more difficult problem, because the more facts they get, the more confident they might become, and that's not necessarily a good thing. So how do we solve this problem of overconfident misperceptions? Well, it's a variety of different kinds of nudges and approaches that can help move people along to realize places where they might not know quite as much as they think they do. Motivational interviewing from the clinical world is a common approach. At the heart of motivational interviewing is asking good questions. At the heart of good negotiation is asking good questions. Adam Grant writes about one of his studies in his recent book, The Power of Knowing What You Don't Know. He has a study showing that skilled educators ask many more questions than average negotiators. That's part of what the skill is, asking good questions so that the person you're talking to, partly at least, realizes what they don't know or gets them thinking more carefully about what they really care about and not to care about. In terms of knowledge illusion, how can you get people to realize they don't know quite as much as they think they do, or that familiar objects or familiar processes like metabolism may not be quite as well understood as they think? Well, you get them to explain it. When they explain it, they do realize that they don't quite know everything that they thought they did. So creating contexts where people can explain the ways in which they actually what they think can help shed light on what they don't shed light to them what they don't understand. You really know whether you know what you're talking about when you can make good predictions, but most of us don't tend to make predictions in normal situations. We don't make formal predictions by saying this and this thing will happen by this and this date with this and this likelihood. That's one of the hallmarks of good forecasting, but most of us don't do it. So this is another one of the kinds of interventions coming out of the cognitive psychology world. This is research from Phil Tetlock. Getting people to make predictions and think explicitly about things is one way to help them shed light on what it is that they don't really know. Okay, second major source of behavior change failure: complacent inaction. Why we don't do things that we know we should, and how can change be sustained? Some of the famous cognitive and motivational biases: status quo bias, a tendency to want to keep things as they are, continue doing what we've always been doing. Present bias. I like this cartoon. Sorry, I'm too busy for anything important right now. Putting out fires from all these little emails. We tend to focus on what's in front of us right here and now, and not be as forward thinking as we might be. And many of the problems where we're looking for behavior change are exactly those, where we're trying to get us out of our immediate present behaviors and get us thinking to outcomes, health outcomes, savings outcomes that will be further down the road by acting today. Okay, so what do we do about biases like status quo bias? For decades, behavioral scientists have been talking about the power of defaults. This is a famous paper, summary results from a famous paper nearly a decade ago by Johnson and Goldstein, showing that in culturally similar countries within Europe, where you have to opt into organ donation, participation is much lower, only about 15% of the population, whereas in countries where the default is to be an organ donor and you have to opt out, if you don't want to participate, around 98% of the population does actually give consent and participate. So you overcome status quo bias by creating a better status quo. Even the perception of defaults can be powerful. Here's a study led by Katie Milkman, who directs the Behavior Change for Good initiative at Wharton, where they run very large studies. They call them mega studies. Here's an example. Different groups of researchers developed different nudges. They nudged around 800,000 people through text messages, trying to get them to get a flu vaccine. They tried around 20 different nudges, all developed by different groups, researchers around the world, and they compared them in a head-to-head to see which ones worked best. The three best nudges were all some variation of saying that a flu vaccine was reserved for the person receiving the message. So there could be many mechanisms or elements in play for these in terms of what made them successful, but a major one is probably the perception of a default. The assumption in these messages is that you would want to get a flu vaccine, so you're not being converted in an important way. You'd want one, but now the system is set up for you to get it. Defaults are like the poster child for behavioral science. How can we get defaults better set up in more of our environments? Here's another example. This is a study that I was involved with Katie Milkman and her then student Heng-Chen Dai, who's now faculty at UCLA. We find that people are more motivated at different times, called the fresh start effect. Everybody knows that people are more motivated for things like weight loss and exercise and diet change around Christmas time. But we show that there are other times as well: first of the week, first of the month, first day after national holidays, first day after people's birthdays. They're just a little bit more motivated. So how to do aspirational type things like this. So how could a good choice environment take advantage of that effect and get people kind of restarting on a regular basis in line with what fits their natural motivation cycles? Here's another neat study from this space led by Hal Hirschfeld at UCLA. This is done in the savings concepts of financial savings, retirement savings. They invite young people, undergraduates in their typical studies, but they've done field studies as well, to imagine what they might look like in the future. And they don't just invite them to imagine it, they show them these renderings of what they will look like in the future. This is actually a picture of Hal, the lead researcher, a digitized picture of him, and then digitized to what he will look like when he's at retirement age. And it's still Hal. He can still see himself in that image. And to young people, that can be quite motivating. Realize that 30, 40 years from now, they will still be themselves. And when they implemented this as an intervention ahead of asking people how much money they would save for retirement, people were more likely to put away money for retirement when they could see a future self, especially a happy future self. So bringing the future closer to the present in key moments of decision is another good feature of a good choice environment. So there are no shortage of effective nudges out there that can move people in the right direction of being realistic about their beliefs and about making good, smart choices for the future. And of course, we need more studies like that. But what I am hoping to see in the coming decades is research within large systems, within health networks, within social media platforms, where best practices in nudging are put together to create good information architecture, good choice architecture, to make it easy for people to believe the right thing and do the right thing. I'll give you some examples of the kind of work that's being done in this direction. Here's just a restatement of what I'm hoping to see. Studies of the actual choice architects and information architects. How can they implement and iterate best practices? We've got some ideas of what these best practices are, but how can we study implementation? How can they preserve freedom for people while still reducing opportunities for overconfident misperception and complacent inaction? That's where I think the big research questions ought to be. The Nudge Unit at the University of Pennsylvania is a pioneer in this approach. Penn Medicine has a Nudge Unit dedicated to improving choice processes within the hospital system, trying to set up places where good defaults can be made, defaults by the healthcare practitioners themselves, by the physicians and nurses themselves, to nudge patients towards best possible behaviors like adherence and such. So I'm going to just mention a couple of studies from that group, focusing more on the concept than the detailed results. But this is a paper, Scott Halpern was a senior author. Clinicians could use choice architecture more effectively in patient management than they actually do. And I'll just read the blurb here. Clinicians assume the role of choice architect, whether they realize it or not. Our results suggest the majority of physicians have inadequate choice architecture competency. The uninformed use of choice architecture by clinicians may influence patients and family members in ways clinicians may not anticipate nor intend. So they asked about a variety of techniques to nudge patients towards more, more health appropriate behaviors or more downstream types of behaviors. And, in some cases, physicians had intuitions about what would work well. In other cases, they didn't. But it was clear that they were not optimally utilizing what's known in the study of nudging and choice architecture optimally. So opportunity for people who are in fact in choice architecture roles to do better choice architecture and better nudging. That's one of the big opportunities. These are some early studies on what the challenge is and what some of the opportunities are. Here's another study from that group, the role of behavioral economics in improving cardiovascular health behaviors and outcomes, implementing a series of nudges among clinicians and among patients within one healthcare ecosystem, systematizing those, automating them, so that they're actually being used at scale, not just in individual cases. So I think that's one big part of the story, finding places within institutions where the choice architects themselves can be supported. The other set of institutions where I think this is important is within social media platforms, where of course misinformation is all over the place, and it's particularly pernicious because misinformation, or some evidence that it spreads more quickly and more deeply than true information, partly because it's often surprising and often emotional. So there are many groups, working with the social media platforms and critiquing them, telling them how they might be able to implement better information architecture practices to help people avoid some of the most problematic overconfident misperceptions that have become so prevalent. I'll give just one example of that. This is featuring the work of David Rand and his colleagues at MIT. Our information consumption habits are not oriented towards truth-seeking or trade-off resolution. So there can be sort of an implicit assumption that social media is just about sharing information and people are going to do the truth-seeking and good thinking themselves. Well, if you think about it, most people browse Twitter and Facebook to unwind, hardly the mindset you want to adopt when engaging in cognitively demanding tasks. People aren't exactly after the truth. But they do know the truth when they see it. And this I thought was an interesting study by Rand and others. So here's what they find first. So just note, people are in the habit of sharing both true and fake news. So they show people a bunch of headlines and they say, would you share this headline? And the answer was yes for around half of the true headlines and just about half of the fake headlines. People were saying, yes, I would share it. You'd hope for a very large discrepancy here between would you share for the true and fake. And that's not what they found. They found that there was pretty similar levels of yes to what would you share. But this is before people had really thought about whether they were true or fake. But you ask them to think about whether the headline is true or fake, and they can kind of tell. There's much better discrimination here. For the ones that are true, it's like 80, 90%, they say, yeah, that's true. For the ones that are fake, they're pretty good. Yes, they get fooled sometimes, but by and large, they're saying those fake headlines, yeah, no, that's not true. But that's not what the sharing pattern looks like. It's just so intriguing about this. The truth-based sharing is not the habit that people have. Social media context focuses attention on factors other than accuracy, the amount of positive social feedback that people receive. So as a result, users get distracted from even considering accuracy when deciding whether or not to share. Those are some quotes from David Rand in describing this work. I think one way to put the question, people currently ask, should I share this? They ask that before asking, is this even true? Could platforms help people get more in the habit of reversing the order of those questions? First asking, is this true? And then asking, should I share? And that's the kind of research that I think we need more of. What are ways that platforms can support better information architecture, support better information sharing habits, so that people are less prone to overconfident misperceptions. So ecosystems with thoughtful information architecture, and then ecosystems with thoughtful choice architecture as explored by things like nudge units to prevent complacent inaction. That's where I hope much of the research action will be in the coming years, and I suspect that we'll be hearing more about these kinds of approaches throughout the sessions at this conference. Thank you very much.